Welcome to the Black Doctor Collective podcast. We as Black doctors are in a unique position. We can change our communities, healthcare, and the world. Of course, we start by changing the way we see and value ourselves. I'm your host, Dr. Shanika Horn, pediatrician and physician coach, travel extraordinaire. I am so happy to have you here and listening. So let's get into it. Happy New Year. We are back for another year. First of all, I'm excited about 2025. Actually, let me knock on wood because, these years, you can't be claiming it's your year in a year past 2020. But I'm glad to have made it to 2025. I am grateful to be here. There's just a hope that comes with the new year that just makes you feel excited. Honestly, a friend of mine was talking about how the new year should be in April or some other month of the year. And I concur because it's a little hard to get excited about January. Not gonna lie, especially January in New York. I think it's supposed to snow tomorrow. I have a flight. I am not about this life at all. Okay. Anyway, so it's another year of me trying to figure out how to work less, get paid more, live life on my terms. And so, naturally you look back a little bit on the previous year. And last year, I have to say, I feel like I worked a lot last year. I worked clinically from February going forward. That's probably the longest continuous contract I've had since I left fellowship. Yeah, I would say so. Because when things start to go awry or things are not adding up, your girl is out. Okay, so I don't do that. I don't like to work in dysfunctional work environments. And so, usually I'm out. But I am at this clinic and we are renegotiating to compensate for some of the dysfunction. And we're going to see how it goes for 2025. What else is new? Medicine is dysfunctional. Join the club, pay the dues. One of the things I am considering in my evaluation of the year and my future plans, right? This concept of working less notion is that time is your most valuable resource, right? You can always earn more money. You can always change or get more of almost everything except time. Time is the thing that you cannot get back. And so when it comes down to it, I really am prioritizing how to control my time, where I spend my time, how much time I spend on things, and how much that time is worth when I do spend it on things, which fully supports my desire to always be paid at a higher rate. And one of the reasons I think that, especially as doctors, that we continue to allow being underpaid is that people don't value our expertise in that way. And we also have kind of been ingrained in us, maybe not to value our own expertise. Here's an example of what I mean. Being on call. In many salaried positions, right, being on call is not like an extra fee. You're just expected to be on call. Sometimes they don't even tell you how much call you're going to take. Sometimes you're expected to just automatically pick up more call if someone else is out. And this is such a crazy concept that you're going to give more time to a job and they do not make any adjustments of salary or pay in any notion. This is something that I had a very prolonged back and forth, even in my current position about, because there was an assumption that I'm an hourly employee, that I would still do call for free, which slavery ended in 1865. I don't work for free. And so there was the conversation around how much do you earn during call? And the argument was that I should be paid little or no money because the call was light, that there weren't that many things that required my involvement. Meaning, if a patient called after hours or overnight, they would first get to speak to a nurse, go through nurse triage. So they are frontline in terms of handling all calls that come in. And if they're unable to answer it, then I would be called. So I'm second call. First of all, I like zero call. I don't care first, second, third. I don't want to be on call, period, because I have to keep my phone on at nighttime. I don't sleep well when I'm on call because I'm paranoid that I'm going to miss something. I feel like I wake up more. I'll periodically check my phone through the night to make sure I didn't miss anything. And so the quality of my sleep is just garbage. For me, that is enough to warrant pay. Even if no one calls me, my life is completely disrupted by being on call. So the argument that I should not be paid for call or that the call rate be very low does not sit with me. I cannot do it, not interested. Second, I have to be of sound mind to make decisions while on call, which means I cannot drink. I can be out partying somewhere where I can't hear the phone or I can't hear who's calling. I can't be inebriated. I have to be of complete sound and coherent mind to be on call. So that's another thing that call is paying for. Like, why should I have to rearrange my life, my sleep schedule for free? Like, that makes no sense. And then the third thing is you're paying for my expertise and my knowledge. You're paying me specifically because you know that if the call gets escalated to me, I'm going to know what to do. I'm going to make a decision or a referral or take some action that allows the patient to receive the appropriate kind of care that they are seeking. You're paying for my expertise. You're paying for my availability. You're not paying based on the number of calls. We're not paying based on call volume. And so that is when I say people don't value our knowledge. I've had many conversations around call, and a lot of the times the argument is around volume. Like, oh, it's a really light call. Oh, it's not so frequent. It's like, no, you're paying for my expertise and you're paying for my availability. You're paying for my coherence. And just even that slight switch changed my conversation around negotiating for call because there were times where I felt myself being swayed by the idea that like, oh, it's not a bad call volume. It's pretty light. I'm basically getting paid to do nothing. No, I'm not getting paid to do nothing. I'm getting paid to be available. All of these little shifts in how we look at work, how we look at the things that we're being asked to do impact our ability to negotiate. And on top of it, I don't want to be on call. So you're paying me to do something I absolutely vehemently am not interested in doing. That's another reason why you have to pay me more, because you need to entice me to do this thing that's literally the worst part of the job. Me waking up at 4 o'clock in the morning to answer any phone calls, you're not going to get the best me. That's why I don't like to do it, because I like to perform at my best. 4 a.m., 3 a.m., that is not my best. So all that to say that when I start to think about doing assignments, getting tasks, having work heaped onto me, additional responsibilities, people love to ask you to do additional responsibilities, and they don't necessarily mention pay unless you do. So that is one of the things I want you to think about in your own life. Like, what are the responsibilities you have been tasked with that were not initially part of your role? And when you got tasked with that, was there any conversation around additional compensation? That is the number one way you're going to figure out how you're getting underpaid or how you're going to stop working so much and not earning enough. One of many things. So this is just one concept of things that I'm considering for 2025 is like making sure there is not a creep on the roles and responsibilities. So right now, this is coming up for me because the job I'm in, we're considering changing my role. I'm going to tell y'all, this is like a little bit of a secret, but I definitely submitted a resignation to this job. I felt that there were a number of things, like I said, you know me, if things are not looking right or it's just not worth the hassle, especially for what I'm getting compensated in some way, or like if there's just so many things wrong that the negatives outweigh the positives, I'm going to leave. I do not believe in sticking around bad work environments. That being said, in this particular work environment, and I'm in the middle of the negotiating this, so this is why I feel very hesitant around even talking about it or describing it. I feel like I'm choosing my words really, really carefully right now in the event that someone, maybe from my employment, were to listen to it. And I know that some of the staff knows I have a podcast and some of them do listen to the episodes. So no one at the job, other than the boss and the manager, know that I submitted a resignation. And now all of you, welcome. But with that said, it was with the mind that if nothing were to change in this job, it's not something that I would want to continue doing. And so that's the basis that I submitted the resignation on. And there's some other nuanced things and some other details, things that would be exposing, I think, to the clinic that I don't want to talk about. But there were a number of factors that led to my decision to submit a resignation. Why am I still there? Here's the thing. Many of the issues that made me want to resign are fixable things. And one of the good things about this place and the owners, like my bosses there, my employers, is that they are very invested in fixing the things. So funny enough, when I made my decision, it was based on the idea of like, I don't like this. And if they're not willing to fix it, then I ain't interested. But now that they are willing to fix it, now we've reopened talks. So I do not suggest ever submitting a resignation as a negotiating tool. I think it's not a tool you want to use, because if you are deciding to leave, you should be certain that that's a decision you're willing to make or ready to make and that you're going through with it, not on the chance of like, if I resign, maybe they'll want to renegotiate with me or that creates some kind of negotiating opportunity. I think that's a terrible way to create a negotiating opportunity. Okay. That's my disclaimer. But talking to the team and how things can be fixed and setting forth a plan, it has become clear that my knowledge from all the different work environments I've been in a lot of locums environments, I've been in a lot of medical centers, clinics, et cetera, across the world, not just even in the US. And that level of expertise, the leadership skills that I have developed through my career, not even just in medicine, just in work in general, really would allow me to assist in making this a successful turnaround. And that's being recognized by the employers. So they are offering me a potential to really improve the way that everything about the clinic, the way the care is given, the way that the employees are managed. Like there's just so much room for my input. So that is a decision that I'm making, is like how to move forward with this clinic and this team. I have to be honest and say that like, as a physician, I think I'm addicted to problem solving. Like I love a good problem, especially if I can see the solution. I'm like, oh, bet I can fix this. And so there's a little bit of that. And I'm trying to be very wary about that, because that is also how you end up underpaid and overworked, is that you see a problem and you jump into fixing it. And so I am very much aware that that is an inclination that I have, that many doctors have. Like, how many of y'all see stuff in clinic that's not within your role and responsibility, but that you will jump in and fix? I think that's just part of our work ethic. Maybe it's in the training somewhere and we just didn't even realize, or it's just part of our natural personality. And we all, especially as doctors, have some level of that in our personality, this desire to problem solve, to fix. But there's something about my personality that makes problem solving exciting to me. There's something about my personality specifically that loves organization, that loves people, that loves the inner workings of things. And I think that makes me more suited to administration. And I've actually thought that for a long time, and I've forgotten about this. And so now I'm kind of returning to it. But this concept of like managing health systems in a way that creates really positive outcomes, not just for patients, but for staff, for the teams that are implementing. And I knew this in residency. I thought I was going to be a hospital administrator until I found out what that really looks like. Like the current hospital administrators in a lot of places are a little bit on the side. We're not going to get into that, my personal opinion, but also the opinion of a lot of people about healthcare, that we're doing profits over people. And so I think I veered away from that culture because of that, because of my experience with this profit over people system. Even when I was in all of my different locums positions, I always evaluated how I could be a leader in my current position. So how do I influence the culture of a place, even when I am not the boss? And I've talked about this in previous episodes, this concept of like how I treat staff, how I even advocate for staff, especially as a physician. We tend to be received a certain way. So if I have the opportunity to stand up for staff or to implement a change or to model certain behavior, like healthy work boundaries, I'm going to do it. And so I think leadership has been something that I am interested in, but it hasn't looked the way that I've thought it should look. And that's why I have not gone in that direction. That being said, this is a potential opportunity for me to take on a leadership role, revamp some things that I can see are clearly broken to a place that's receptive to fixing the things. Now, we'll see how receptive they are about renegotiating the money that's going to be required to execute this. But I'm curious to see how this year is going to shake out. I think it's going to be very interesting, I think, for me personally, I think in terms of my career, and I'm excited about it. So I am hanging on a little bit longer in this work environment to see how things shape up. And this ties right back into how I started, is this concept of being paid for my knowledge and expertise, because administrative positions are not patient-facing roles. And we know in medicine, everything is about the patient-facing part of the job. So like your RVUs, finishing your notes is not even a lot of time. It's how much time you spend in the clinic room. It's how much time you spend doing a procedure, or what all the things that you can provide to the patient. And so when we have to apply our knowledge, whether that's like answering questions in a patient messaging system, or talking to patients on the phone, or arguing with insurance companies, doing prior authorizations, whatever it is, that part of our job, the part of our job where it's just us applying our knowledge and expertise, is not valued as highly as those patient-facing interactions, like in an actual room that gets billed. And it would be easy for me to then associate my role in like a leadership position or administratively to either do these things for free because I'm not doing anything patient facing, or I might be able to do the bulk of this stuff from my house, or to do it for cheap. And in this case, that's just so not correct. My knowledge, my expertise is such that I will be able to fix problems that will result ultimately in even more income for the clinic, right? Not just patient outcomes and patient satisfaction and employee satisfaction, but these things translate to money. And so anything that I do that translates to money means that I should also be compensated for that thing, period. So that is how I am looking at this year and thinking about how to present my value and to charge for it. That is how I am continuing on my path of trying to earn more while technically doing less, because my time Each unit of time is worth more because my expertise continues to grow. That's what I'm excited about for this year. Anyway, I am excited about the rest of January. I'm actually going to spend more than half of it in Ghana. Y'all know I don't like to work in January because it's cold. And so any excuse that I have to either not be in New York during the winter time, and definitely if I'm in New York, not to be leaving my house, that's what I'm going to do. So I am off clinically for the remainder of January. Well, for all of January. I haven't been in the clinic since Christmas Eve. But I am really looking forward to what this role is going to bring. I'm looking forward to January because now I've filled it with things that I actually look forward to doing, which is going to Ghana and hanging out with my boyfriend and then coming back and serving my coaching clients as they are going through some negotiations, some really good ones, things that really fill my cup. And I'm going to spend some time, I think, working on this project for this clinic. Also going to negotiate before I start working on this project. But yeah, lots of fun things coming up for January. I'm excited. I just want to also say to those of you who have been listening to the podcast, who have been binging the podcast, who are giving me feedback, I so appreciate you. Let me know what you want me to talk about. Let me know what you want to have discussed. I'm going to start answering some of the questions that I've seen in future episodes. So that's coming up. I'm going to start having some more guests on here. It's going to be a really good year. I'm looking forward to the content for this year. I'm looking forward to what I'm going to be able to produce this year. I'm excited for you guys. I hope that in listening to this episode and all the previous ones, that you're taking away things and you're changing the way that you work and the way that you show up, whether it's staying in your current job and just exercising new boundaries, whether it's renegotiating your current contracts, whether it's looking for a new position because this old one really isn't meeting your needs. I am looking forward to hearing all of the things that you guys are doing as a result of sharing this space with me. Happy New Year. I'm excited. Welcome to 2025. Let's get it done. Thank you so much for listening. Please subscribe to the podcast. And what I want you to do next is link us everywhere you can. Instagram at The Black Doctor. Just become part of our collective. I want you here. Thanks. Until next time. Bye.